Betty. Oh, I'm just gonna shut the door here. My name is Paige. I'll be your student nurse today. So I got an order from the doctor that you needed blood today, but first can I just have you verify your name and date of birth for me? Betty Jones, 5/18/1996. Perfect. And then I did see that you and the doctor went through the consent. You guys both signed it. Do you have any other questions for me? Have you gotten blood before? No? Okay, so basically we're just gonna start this infusion, we're gonna start the blood, and then I'm gonna stay with you for the first 15 minutes and just check everything out. Make sure that everything is going okay. You're not having a fever, you're not having shortness of breath, you're not having a chest pain or back pain, or you don't have any hives or rashes or anything like that. But if after the 15 minutes that I'm gone, you start to have those symptoms, I'm just gonna have you put your call light on, get me in here right away, and we're gonna get everything all situated. So first, I'm going to check to make sure that you have the right needle size. So a typical needle size for blood would be 18 to 22 gauge. It looks like you have a 20 gauge here, so that'll work perfect for this blood. And then I'm just gonna make sure that it is working correctly, because we don't want to start and then it's infiltrated or anything like that. So I'm just going to do a saline flush. First, I'm gonna make sure that there's no air bubbles in this. We don't wanna put bubbles into your veins. Okay, so then I'm just gonna clean the area. And flush. All right, perfect. Your IV is working well. So we don't have to worry about that. And then I just had one of the other nurses bring me your blood, so we're just gonna verify all that stuff on there, make sure that everything's looking good, everything matches, it's compatible. And then we also use normal saline because that is what's the only thing that's compatible with blood. So we'll flush that line through, make sure that there's no air bubbles in it, and then we'll clamp that and then get the blood going. And then after the blood is done, we will run through with saline again to make sure you get all of the good stuff. All right, so in real world, I would have two people here with me. One would be holding the blood and looking at this, and one will be going through the sheet, but for the video, I will be doing both parts. So we have the med record number, which is 2224466. Med record number 224466, location HLRL, location HLRL, account number 123456, account number 123456, patient name Betty Jones, patient name Betty Jones, patient name Betty Jones. Red armband is 546654, armband 456654, and then her real armband, since it was the same as the sheet, I'm just going to use the blood bag, which is 456654, 456654. Patient blood type B positive, patient blood type B positive, donor pool number 7890, donor pool number 7890, units in the pool 4, units in the pool 4, volume 250 milliliters, volume 250 milliliters, blood component PRBC, blood component PRBC, expiration date time 6/21/2022 at 1500, expiration time date 6/21/2022 at 1500, donor blood type is O positive, donor blood type O positive. The compatibility test was completed. Compatibility test was completed. Date 1/21/2022. Date 1/21/2022. Now I'm just gonna inspect the bag. I don't want any abnormalities. I don't see any clots in here. I don't see any air bubbles. and it looks to be normal color to me. So now, Betty, I'm going to get a baseline vitals. Listen to your lung sounds. So I would have a stethoscope on and just listen to her lungs, the sides, and the sides. And your lungs sound clear, everything sounds good. Your vital signs are within normal limits. Everything looks good there. So we are okay to start the blood. Just gonna wash my hands one more time, switch my gloves because I want clean gloves for when I start touching all of the blood products. So first we are going to flush the blood tubing with the normal saline. And none of that is expired. But before we start, Betty, do you have any allergies? So any latex? Anything like that? No? Okay, great. So this might look a little different than any tubing you have seen before. So it has the two ends. One's going to be for the normal saline, one's going to be for the blood. The first thing we'll do is connect the normal saline so that it can flush the IV tubing, like I said, because we don't want to put any air bubbles into your veins. So we'll hang that. And then make sure everything is unclamped and flowing, which it is. So then we'll clamp that. And then we're actually going to connect it to your wristband right away while I get the blood all set up. So we'll alcohol swab that and put it in. So this is clamped, so it's not going in at all right now. And then we're actually going to clamp this too because we don't want backflow from the blood because that'll run later. So I'm just going to get this in here. Alrighty, buddy. And before we get this all started, I'm going to check the mark one more time. And we're going to do your 5 rights 3 times. So we have 250 milliliters. 250 milliliters for Betty White. So, or Betty Jones. Betty Jones, 250 milliliters. This is Betty Jones. This is 250 milliliters. It is correct with the MAR. So Betty Jones, 250 milliliters. You have Betty Jones here, 250 milliliters. Betty Jones, 250 milliliters. We have Betty Jones here, 250 milliliters. So the normal rate for blood is 50 milliliters per hour. We don't want to put it in too fast. And the time that blood can run over is 4 hours. We don't want to do this for more than 4 hours. So we are going to make sure that the 50 will get your 250 in 4 hours. We're also going to make sure, I made sure that this blood was it was in room temperature for less than 30 minutes because we don't want it to go over that. And per policy, sometimes they put blood in a blood warmer, which if the policy here was to do that, I would have done that as well. So I'm just going to program the pump. So we can get your ID in there. You were in there already. We're selecting the channel now. The fluids. So we have, just want to make sure this is perfect. We have the RBCs. So we're going to go to blood RBCs. Perfect. That is correct. So the rate, like I said before, it's always going to be 50 milliliters per hour. And then the volume to be infused is the 250. So that'll go over the time. Do you have any questions before I start this? No? Okay, perfect. like I said, the signs and symptoms of a bad reaction are the shortness of breath, all of that stuff, the chest pain, back pain, not feeling well. So as long as you're feeling okay, then that's good. And if you were to have a bad reaction, I would stop the blood. I would get new saline, I would get new blood, change your IV out, change all of the tubing, and I would run normal saline through and then let the provider know. So that is good. So we're gonna stay here for 15 minutes. I'm just gonna stay with you, make sure that everything's going okay. After that, I'm gonna come back in and check your vitals again at the 30-minute mark after the blood has started, and then I will come back an hour after the blood has started and check your vitals once again. So then I would clean up all of my stuff, make sure that everything is all good. While that's running, I have everything put in the correct places. And then after this is done, I would document how she tolerated it, the time I started, the time I stopped, all of the vitals of all the times that I came in here. If she did have a bad reaction, like I said, I would notify the provider, get all of that stuff done, change all of the tubing, and I would document the time it started, time it stopped, how long it went over, the type of blood, if it was compatible, what I used with it, and then that would be all. So then, since I have everything put away, I would remove my gloves, wash my hands, make sure that Betty is comfortable, give her the call light, and that's my video.